this is something where I would like you all to think as to if you can guess the diagnosis. This is the first patient. He had an uneventful cataract surgery. The cataract surgery was very smooth. The cornea was clear. At 1 month follow-up, his best corrected visual acuity was 6/12 N10. Now, when we see this kind of vision at 1 month post-op, the first thing is to do an OCT because you want to see is there any macular edema. The OCT was also very hazy, but through that we could make out that yes, there is no CME. But my AR, my auto-ref is showing me variable readings. As I can see here, my SIL is varying from 0.75 to 2.75, 1.25. The axis is changing 12, 34, 177. So at this point, I would like if anybody wants to guess as to what is going on.
So I have a response saying that it could be due to corneal edema or due to the suture on the cornea.
Okay.
DMD, I think Decimex membrane detachment probably.
Okay.
Okay, so a couple of different responses on different thought processes.
Right. So I guess looking at the SIL, yes, you are thinking of a suture on the cornea, but that would not cause this fluctuation in readings that I am seeing. My SIL would then be consistent. Across my different AR readings, it would not fluctuate from a minus 2.75 to a minus 0.5. So that is a clue. A corneal edema or DMD would have been picked up during the course. Okay, and we would know that. Yes, so I think somebody is come up with the correct diagnosis that this is a dry eye.
Dry eye, yeah.
Yes, so this is typically what we see in patients who have dry eye. Dry eyes are very common post cataract surgery, post any surgery, because you're cutting the corneal nerves when you make your incisions. And it is what is going to cause fluctuating AR readings. The other clue is that the OCT is hazy as you're trying to capture it. Okay, so what we did in this patient is, sorry, just a minute. Yeah, put in 3-4 drops of the lubricating agent, then repeated the AR and refraction, and his vision improved to 6 parts N6. So please think of this diagnosis when you have worked up the patient for other things, when you have seen the cornea is clear, when you've seen that there is no CME, the retina is fine. It could just be something as simple as a dry eye, and all the patient needs is lubricating drops. Post-surgical dry eyes. A couple of more examples. Post-surgical dry eyes can present in a number of different fashions. The second patient, where everything was fine post-op, routine uncomplicated surgery, all he had was watering from the eyes when he's stepping out in the sun. So he's not able to take the bright light, and that is causing the watering. Third patient comes back 1 week after stopping the drops. After we finish the 1 month of steroid drops, after stopping that, comes back with redness, photophobia, watering and bright light. Of course, any patient who comes back a week after stopping the drops, the first thing we think of is inflammation, that he's got some rebound uveitis after stopping the drops. But when we examined the patient, the AC was quiet. So in this case, we gave lubricants to the patient because dry eyes will also present with redness, photophobia and watering, and patient had a dramatic improvement in their symptoms in a few days. What are the causes of post-surgical dry eyes? Prolonged treatment with drops which have preservatives. Sometimes patients might need steroid drops for a longer time. Corneal incision, as I said, because we end up cutting the nerves. Patient might have a pre-existing dry eye, or sometimes a longer surgical time where there is more exposure to the light from the operating microscope. Sometimes it could be neither of these. It's a routine treatment. The surgical time has been normal, but the patient still develops the dry eyes. So important to keep that in mind, diagnose it and treat it accordingly. What are the symptoms? As I have already mentioned, routine symptoms, what we experience in any patient of dry eyes, even if they've not been operated: grittiness, heaviness, sensitivity to light, pain, watering, fluctuating vision, not happy with vision. Patient comes back then tells you that I'm not happy with my vision, even post-surgery. Put them on a lubricant. Always rule out other causes of reduced vision, which are important, like a cystoid macular edema or inflammation, before we attribute it to dry eye. Just thinking of dry eyes, we should not miss the more important causes. But when we know that all of that is fine, then yes, definitely put the patient on lubricants. Lubricating drops, very helpful. Supplementing with oral omega-3 fatty acids again will be quite helpful.